Some important information regarding cranial nerves. Medial medullary syndrome. Hypoglossal nerve is compromised. Hypoglossal nerve is cranial number 12. Lateral medullary syndrome. Cranial nerve 9, 10, 11 are compromised. Then next topic. Floor of cranial cavity. Anterior cranial fossa. Multiple openings in the cribriform plate of ethmoid bone. For cranial nerve 1, olfactory nerve. Optic canal. It is an opening in the lesser wing of the sphenoid. It is meant for passage of cranial nerve to optic nerve. Superior orbital fissure. It is a gap between anterior cranial fossa and middle cranial fossa. It is a gap between a lesser wing of sphenoid in the anterior cranial fossa and greater wing of sphenoid in the middle cranial fossa. It is meant for passage of cranial nerve 3, 4, 6 to supply to the muscles of eyeball. Cranial nerve 5-1, ophthalmic nerve, also passes through superior orbital fissure. Middle cranial fossa, openings in the greater wing of sphenoid bone. Foramen rotundum, passage of cranial nerve 5-2, maxillary nerve. Foramen ovale, passage of mandibular nerve. Foramen spinosum. Foramen lacerum. Lacerated foramen medial to foramen ovale. Foramen lacerated foramen medial to foramen ovale. Body of sphenoid bone. It is present at the floor of anterior, middle and posterior cranial fossa. It has a posterior fossa called as sella turcica in the middle cranial fossa. Posterior cranial fossa. Internal auditory meatus. It is an opening in the temporal bone. It is meant for passage of cranial nerve 7-8. Jugular foramen. It is a gap between temporal bone and occipital bone. It is meant for passage of cranial nerve 9, 10, 11. Hypoglossal canal. It is an opening in occipital bone. It is meant for passage of cranial nerve 12. Foramen magnum. It is meant for passage of spinal part of cranial nerve 11. Cranial nerve 3, 4, 6. They originate from the brainstem. They pass through cavernous sinus lateral to pituitary gland, then pass through the superior orbital fissure. They supply muscles of eyeball. Cranial nerve 3 is the most medial and cranial nerve 4 is the most lateral. Cranial nerve 6 lies in between cranial nerve 3 and 4. Cranial nerve 3, oculomotor nerve. It lies close to cranial nerve 2. Cranial nerve 4, trochlear nerve. It lies close to cranial nerve 5. It is the thinnest cranial nerve. Cranial nerve 6, abducens nerve. It pierces the dura in the posterior cranial fossa, runs in Dorello's canal and finally becomes a content of cavernous sinus and then passes through superior orbital fissure. It lies in between cranial nerve 3 and 4. Cranial nerve 5, trigeminal nerve. It is the thickest cranial nerve. It has 3 branches: ophthalmic, maxillary, mandibular. 5-1, 5-2, 5-3. Ophthalmic nerve and maxillary nerve becomes contents of cavernous sinus. Mandibular nerve is not content of cavernous sinus. Ophthalmic nerve branches pass through the superior orbital fissure. Maxillary nerve passes through foramen rotundum. Mandibular nerve passes through foramen ovale. Cranial nerve 7-8. They pass through the internal auditory meatus in the temporal bone in posterior cranial fossa. Cranial nerve 9, 10, 11. They pass through jugular foramen. Cranial nerve 12. It passes through the hypoglossal canal in the occipital bone. Spinal part of accessory nerve enters the cranial cavity through foramen magnum and exits through cranial cavity through jugular foramen.